Good afternoon, everybody, and thanks for joining us today. Please note there's live captioning and ASL translation are both available, and that a recording of today's session will be posted later today. I'm a big Michigan basketball fan, and I can't resist the opportunity to congratulate the men's team on their hard-fought 79-66 victory earlier today over Maryland in the quarterfinals of the Big Ten tournament. In particular, a shout out to Mike Smith for his season high 18 points and tournament record 15 assists. Go Blue. Today we're going until 3. We'll get to as many questions as we can, and you could ask the questions through the Q&A function. Through at least the end of this month, we'll be hosting these briefings bi-weekly. On Fridays, when there's no campus briefing, Michigan Medicine will be hosting town halls for the U of M community. Today, we're joined by Provost Collins, Vice President for Student Life, Martino Harmon, Chief Health Officer, Dr. Preeti Malani, Dr. Rob Ernst, Chair of the Campus Health Response Committee, and Dr. Sandro Cinti, Infectious Disease Physician and co-lead of Michigan Medicine's COVID-19 Vaccination and Therapeutics Task Force. We've been working on plans to make our fall semester look and feel much more like a traditional academic and residential term at U of M. And today we'll announce some of the details that we have in place. For the fall semester on the Ann Arbor campus, I'm pleased to announce that we will teach most classes in person and have greater occupancy in our residence halls, in-person dining and student support services, along with some continuing precautions to maximize health and safety for our university community. This aligns with our goal of an innovative and responsible return to in-person education and a residential campus experience. The information we're sharing today is based on a number of factors, including our anticipation that the COVID-19 vaccine will be much more widely available in the weeks ahead than it is today. We're also seeing hopeful declines in new cases on campus and around the nation. Getting our community to a place where we can be optimistic has required the diligence of thousands, and I want to say thank you. To the students who followed our public health guidelines and so clearly cared about the health and safety of our campus and the people who live in Washtenaw County, cases continue to decrease. This is of great importance to our community, and I want to give you all a ginormous thank you. To the faculty, instructors, and staff, including our graduate students, who've risen to the challenge of this pandemic to uphold our teaching and research mission. Our labs are at 75% capacity, our libraries and museums are open, our students are making progress to their degrees both remotely and in person, and our hospitals and clinics are saving lives and administering 100% of the vaccines we are allocated by the state. Thank you. And I want to give a special shout out to the many teams and individuals whose tireless daily work has made all of our success possible. Our RAs and asymptomatic testing corps, the UHS, EHS, and OHS teams, our housing and dining professionals, custodians, bus drivers, CAPS, the Emergency Operations Center team, DPSS, ITS, and many, many more. Thank you, thank you, thank you. These plans presume that any of our faculty, GSIs, and staff who wish to be vaccinated will have access to vaccination before the fall semester, and that a significant fraction of our students will have been vaccinated by then as well. We encourage everyone to get vaccinated when it's their turn. If the levels of vaccination exceed these expectations, we'll adjust as the semester progresses by further increasing in-person activities and relaxing public health measures. We've been engaging with many groups of students and faculty and staff. This includes the leaders here on today's Zoom, our deans, and many others who've helped create the framework for our goal for fall that Provost Collins and Vice President Harmon will describe momentarily. We have a lot more work that needs to be done in collaboration with our community to hammer out all of the details. We'll also be prepared to change these plans if necessary. And please note that as conditions change and more certainties emerge throughout the coming months, we'll continue to discuss these developments with the broader U of M community. We've heard from faculty advisors and parents that the pandemic has increased our students' concern and anxiety about their futures. This point was raised in a faculty governance meeting I attended earlier this week as well. Whether it's our undergraduates wondering about getting their first jobs, or a PhD student concerned about the availability of faculty positions after graduation, our return to a more normal in-person fall semester represents an opportunity to come together and help our students best prepare for an uncertain future. We want our students to be able to learn in the best way possible, and our faculty and staff to do what they do best and succeed at the highest levels. Earlier this week, Michigan Athletics announced that they're working to bring fans back for our sporting events in the fall. I also hope we can resume live performances in our various arts venues on campus. These are just some of the many features of our university environment that we're working on to make the fall semester feel more traditional. We want to bring back the Michigan campus experience for our community. Before we begin, I want to note that it was a year ago yesterday that we announced that classes would shift to remote formats for the remainder of the semester. And a year ago tomorrow, we encouraged students to move home and employees to work from home. I would assert that those were the moments that set the stage for our road to recovery. Since then, it's not been easy for anyone. But you've persevered and are working to get us back to the University of Michigan that we all love. A university that teaches and learns and conducts world-class research, serves the public and cares for millions of patients, all at the highest possible level. Most of our activities have been wrapping up the past few months. That's a credit to all of you, your dedication, and the sacrifices you've made throughout this pandemic. Thank you very much. And now I'd like to turn it over to Provost Collins.
Good afternoon, everybody, and thank you very much, President Schlissel. I would like to speak about our planning for the fall, setting it in the larger context in which we are making our decisions for the next academic year. As already mentioned, recent news and trajectories are very positive, and COVID risks are already significantly lower. Medical treatments can prevent severe illness from COVID, and testing for the disease is now widespread. A third highly effective and safe vaccine has been approved, with growing evidence that vaccines reduce disease transmission and protect from severe illness. Vaccine availability is increasing. President Biden has called for all adults to be eligible for vaccination by May 1st, and Michigan is now vaccinating those 50 and up with a medical reason. All who are 50 and over will be eligible starting March 22nd. And our governor has just announced that all adults in Michigan will be eligible by April 5th. The CDC has also just announced new guidance for greater interactions among vaccinated individuals. So though a definite vaccine timeline continues to evolve, we can expect that by the end of the summer, the vast majority of our faculty, GSIs, and staff who wish to be vaccinated will be vaccinated, and a growing number of our students will have been vaccinated as well. As a world-class academic institution, our planning for the fall is guided by a number of core principles. And I'll start with teaching excellence. We serve our academic mission by offering students transformative and engaged learning experiences both on and off campus, and by attending to their diverse educational needs. In this context, a residential education is really core to who we are as an institution and central to our ability to serve our academic mission. We're also guided by our shared commitments to research excellence, to community well-being, including physical, social, and emotional health, to diversity, equity, and inclusion, and to creating work environments that serve our mission and enable faculty and staff to thrive. Given the current trajectories and working together, we can achieve the goal of an innovative, responsible return to a residential experience in the fall with significant and increasing in-person engagement and minimal health risk for our faculty, GSIs, staff, students, and broader community. Of course, if the positive trends change, we will adjust to keep people safe. We know how to do that. However, if the levels of vaccination exceed these expectations, we will adjust as the semester progresses by further increasing in-person activities and relaxing the public health measures. Not only is it very likely that we can be ready for a more normal fall semester, It's extremely important for us to do so. Reactivating our residential experience is essential to supporting our commitment to the university's overall mission. In particular, while we've been inspired by the hard work, dedication, and creativity of our faculty, staff, and students, our academic mission requires us to return to the residential experience as soon as possible. We need to return to on-campus learning to support our students' academic success, as well as to support their well-being and to create the connection and community that are important to the overall learning experience. In a year of primarily remote instruction, we've learned a great deal about when and how that is valuable. It's expanded our reach and fostered innovation, and we will certainly build on this going forward. I, like many across campus, do have concerns about the effect of continuing remote-only instruction into the fall on the well-being of our students, faculty, and staff. And I appreciate the many efforts of people throughout the campus community to help address these concerns. I'd also like to thank the great many faculty, students, and staff we've consulted so far in our planning. In addition to the outreach that's occurred across the schools and colleges, we've had very helpful discussions with many groups, including SACUA, the Faculty COVID-19 Council, LEO, and GEO. Through these initial engagements, we've received important feedback about our plans. There's much yet to be worked out, especially at the school and college level, and we must all accommodate the uncertainty about how controlling the pandemic will progress. We're committed to engaging with instructors and the community in many ways, again, especially within the schools and colleges, as programmatic needs will be key to those decisions. Let me now turn to what an innovative, responsible return to a residential experience will look like. Most moderate-sized and smaller classes and seminars, as well as discussion sections for larger classes, will engage in person. Most large lectures will remain remote and will continue to accommodate needs such as for international students by providing some hybrid and remote options. However, campus will be reactivated with many opportunities to connect with others face-to-face. We expect a full return of the University of Mission research enterprise with lab, field, and human subjects research in person and participation by our undergraduates as well as our graduate students. Student groups will be able to meet. Study spaces will be open with extended hours, and the libraries will expand hours and services. Student-facing services such as academic and career advising will be available both in person and remotely. While our museums and botanical gardens are currently open on a limited basis to University of Michigan students, faculty, and staff, our goal is to welcome back all visitors to these incredible spaces. And we'll be expanding activities across campus related to community building and well-being. In addition to the typical first-year orientation activities, we will have special outreach to our sophomores to ensure their engagement as well. Schools and colleges will lead the decision-making about course modalities with decisions focused on pedagogical and programmatic needs. As the risk of severe illness is mitigated, it is important for us as a university to transition back to the general expectation that our instructors be available for on-campus engagement, of course, while maintaining policies and procedures for those with special health needs. With today's announcement of a university-wide goal for the coming academic year, I'd like to emphasize that the real work for fall planning will be ongoing in the weeks and months ahead. We've made a good start and fully appreciate the importance of engaging with faculty, students, and staff in each school and college to understand their perspectives and concerns and find ways to address them as we move forward. Each of us has a role in this work: central leadership, deans, department chairs, faculty, GSIs, staff, and graduate students as well as undergraduates. Our planning will include developing workable scenarios that build on public health expertise and employ a range of mitigation measures to address the concerns that we hear. And these will be the foundations for more detailed planning and provide guideposts for us to move forward. It will also include understanding vaccine hesitancy and encouraging members of our community to get vaccinated when they are able to do so. We recognize the impacts of K through 12 instruction decisions, particularly decisions by Ann Arbor Public Schools on our community, and we'll continue to look for ways to support their return to in-person instruction, such as the recent teacher vaccination effort. So far, I focused on reactivating the University of Michigan's student-facing activities. This will require bringing many faculty and staff back to campus who've been working from home for many months. The current state order specifies that work activities that can feasibly be done remotely must be done remotely. And as this order is relaxed, it will be important for us to gradually re-engage student-facing faculty and staff to return to campus. We look forward to finding ways to welcome people gradually back to campus. At the same time, we have learned that there are many parts of the university's work that are critical for teaching, research, and service, but that are not student-facing. And we want to be very thoughtful about how and when people in these roles return to campus. It's essential for us to take advantage of all we've learned and continue to learn about how our work is and can be done. This is a unique opportunity for us to be innovative and strategic about how we accomplish our mission, and not to simply go back to how we used to do things. Decisions about returning to campus will be made primarily at the unit level so that staffing levels align with program needs and are attentive to equity concerns, and also recognize public health requirements. We will provide advance notice so that our employees have time to plan for a return to campus. We'll also be working on a set of interrelated university goals to inform how each unit leader develops plans for an equitable return to campus. Those goals, which support our mission of excellent teaching, research, and service, are increasing efficiencies and reducing costs, in particular by reducing space needs, reducing our environmental impact, and helping to achieve the university's carbon neutrality goals as those are developed, and enhancing our position as an employer of choice with attention to employee satisfaction. We will be devoting time at a future briefing to discuss these issues further as the university's planning proceeds. So to end, let me thank you for all that you are doing and continue to do. We are excited to work together as we plan an innovative, responsible return to a residential experience in the fall. Thank you.
Thank you very much, Provost Collins. There are lots of questions, obviously, that are coming in, and many of them are actually being answered in real time by the provost, and then in a moment by Vice President Harmon. And then, we'll collect the others, and we'll try to save time at the end for many of the others as well. Next, Vice President of Student Life, Martino Harmon. Martino.
Thank you, President Schlissel, and good afternoon, everyone, and happy Friday. I am excited to announce that we will offer students a more traditional on-campus residential experience in the fall term. Our undergraduate capacity will allow us to accommodate all first-year students and as many other returning students as possible based on availability and need. In addition, we will offer a residence hall experience to graduate students who apply for housing while still providing a safe living space. The residence hall occupancy in the fall will be nearly 80%. We're planning on a more traditional residential experience with lounges and study spaces open, more programming, and increased engagement with staff. Michigan Dining will provide dine-in options by reservation and to-go meals for students who prefer to eat outside or in their rooms or with pods. There will be expanded access to student life facilities such as the unions, recreation sports facilities, and other student services. We expect student organizations will have more opportunities to gather in person. In terms of student engagement, we are determined to provide as many safe in-person activities for students as possible to build community for both new and returning students. For students who prefer or need to engage with campus in a hybrid way, we'll also continue to leverage online tools and resources designed to enhance engagement. And of course, all of this is dependent on public health guidance and restrictions from state or local authorities that may be in place at that time. And we should expect that some public health restrictions, like wearing face coverings and social distancing, may still be necessary. Next, I want to talk about vaccinations and university housing. So vaccinations are recommended for all students and student life staff before fall. We're strongly encouraging all students applying for housing to receive a COVID vaccination as soon as it is offered in their local communities or in Ann Arbor. Receiving a vaccination will help University of Michigan Housing to provide a safe and engaging residential experience, and will allow us to provide more options when assigning students to housing this summer. Housing will share more details in the weeks ahead, so look out for that. And then finally, I want to talk about building community for new and returning students. As you may recall from past briefings, Student Life, we've engaged a student engagement task force which will continue their efforts, particularly for students who were not able to have a traditional first year. We're looking at specific programs and initiatives that have been really well received by students so far, such as the Resource Navigators Program, groups and buddy matchups for students in similar academic tracks, shared interests meetups, and weekly communications about opportunities to connect on campus and online. We're also exploring how to scale the capacity of our cohort programs for the fall, given that students told us this cohort approach has been valuable and supportive to them during the pandemic. We're continuing conversations with our academic partners about co-curricular integration, which connects students with activities and experiences beyond the classroom. Finally, we're focusing on creating vibrancy and engagement, especially during the first 6 weeks for fall 2021, so that we can provide anchoring experiences normally associated with the Michigan experience for first-year students. And I'll have more to share on this topic in the weeks ahead. Thank you very much.
Thanks, Vice President Harmon. Before we continue, I know many staff will have questions about when they'll be returning to in-person work, and both the Provost and Vice President Harmon alluded to this. Our preparation for fall will mean that certain groups of employees that have been working remotely will be returning to work on campus sometime in the spring or early summer. We'll be reaching out at the unit level, since that's where the decision-making about staffing, where staffing needs are going to be made. It's important to note, however, that the principles we shared about a month or so ago still apply. We recognize the disruptions the pandemic has caused, and when more of us return to in-person work, we'll do it gradually, and we'll provide as much advance notice as we can so you can make plans. Units are already developing plans for the future of work. How much can be done on campus and how much can be done remotely based on engagements with employees in various units. The university have more to say about these goals in the months ahead. Personally, I'm excited about the future of a kind of hybrid workplace where people spend part of their time working remotely and part of their time on campus. It has a great impact on our parking problem, our congestion problem, our environmental footprint. And for many people, the flexibility to work at home part of the time is also valuable to keep us as a workplace of choice. So we're studying this hard, and we'll have much more to say about this, and we're interested in your opinions about this as well in the weeks ahead. So let me turn things over now to Dr. Malani to address some of the safety planning, and then to get to your questions. Take it away, Preeti.
Yeah, thank you so much. And I just want to reflect for a couple of minutes. It was exactly a year ago that we made this rapid, really kind of unimaginable pivot to remote learning, working, teaching. And at that moment, it was really all about transmission of infection. Nothing else came first. It was really about COVID. And we had to make a lot of hard decisions, and there were a lot of unknowns. And I have to say, it was really hard to even imagine this day. And I think this is an amazing moment. So many people have worked hard to get us here, but these uncertainties are going to remain, and we are going to have to stay nimble. Now, if you think of last year as a switch, you turned off the lights, shut the door, said, go home. This is a dial, and it'll dial up and it'll dial back. And, I actually am very optimistic that the fall is going to look a lot like it used to look. But there are things that we cannot anticipate. I know there are a lot of questions about vaccines, and we're going to talk with Dr. Cinti about that. And again, I think be patient. Things are getting better. I just also want to note that it's also 1 year ago that Michigan Medicine began admitting our first patients with COVID-19. And I think this moment brings a lot of different emotions for people, including myself. And grief and sadness is part of it. So please, let's show each other some extra kindness. And I want to remind everyone of the resources that are out there for people who are having a hard time and like to talk to someone. Office of Counseling and Workplace Resilience, FASCO, CAPS. Also noting, before we talk about the fall, it's springtime in Ann Arbor. It's beautiful. It's March. It's basketball. It's St. Patrick's Day. I know a lot of the students in particular are looking for a change of scenery. My advice is what it always is be careful. Small groups, stay indoors, wear your masks. In particular, I want to just mention something because it's come up, is if you're traveling back and forth to visit your family, be particularly careful. I know people's families are getting vaccinated, which is wonderful, but hang in there a couple more months. You'll get tested. It's really about what you're doing to keep yourself safe. What we don't want is anyone to take COVID home. So I don't know if Martino has any last comments about St. Patrick's Day, but otherwise we'll move over to Rob and we'll do some of the Q&A.
Dr. Malani, you hit the right notes. I think it's so important to know that we understand students, like everyone else in society, you're exhausted. You want to gather, you want to have fun, and we just encourage you to make smart decisions, to gather in small groups, gather in your pods, do those things to keep the campus safe. We've been doing well lately, and the end, or at least a big positive change, is really close. And it's so important for us to hang in there and not lose where we stand right now. So I just want to encourage you to do that. And know, if you look on the CCI website, there are several different programs and activities planned for next week that you can participate in. So just do it safely. That's what we're really asking.
Absolutely. Keep doing those things. Okay. And I don't know if we have the slides. Otherwise, I'll just start with, okay. Yep. They're coming. So Dr. Ernst, this is like our, every couple of weeks. And I think the news keeps getting better. I know we want to mostly talk about the fall, but quickly, what's it like on campus?
Hi, Preeti. As Vice President Harmon just said, we're doing pretty well right now. Case counts amongst U of M students have been coming down pretty steadily since their highs in early February. Right now we're at a very low level. In fact, we're as low as we've seen since the start of the fall semester some time ago. So with that, we're still doing a lot of surveillance testing, and if people are checking the Mason Blueprint dashboard, our case positivity rates are extremely low right now. So it does seem like people are doing the right things in terms of staying in their bubble and staying with their tight group of folks and observing some of the guidance that we have in place for gathering sizes and masking. So our containment teams are now fully caught up and doing really well at prompt case investigation. And, our occupancy in our quarantine and isolation spaces are extremely low. I think we only have like 10 students in quarantine right now. So things are really good on campus right now.
That's wonderful. I know it's been a lot of hard work, not just for your team and all the other teams, but really from the students themselves. So thank you. Let's talk about the fall semester. What is the Campus Health Response Committee that you lead and that I'm part of anticipate for the fall semester in terms of, what's it going to look like? What's mitigation going to look like?
Well, as everyone's been saying, it's very optimistic about the rollout of the vaccine and what we're hearing about the opportunities people will have to be vaccinated. And the vaccination does provide the avenue out of the pandemic for us. With that, I think we'll start shifting some of the things that we'll be doing, but into the fall, as just been announced, more residential and more in person. We're going to have to maintain some elements of surveillance and certainly be prepared for containment of any outbreaks should they occur. Those are the key pieces and components of are going to be of our plan. So we're very fortunate that these are really mature processes now that we have. What I expect is that as more people become vaccinated, The shift will be away from some of the surveillance of asymptomatic people, but we're going to have to be really prepared to be evaluating folks who are developing symptoms and make sure that we have a real clear guidance for students and faculty and staff on how to be evaluated if they have symptoms. So both maintenance of some surveillance, really tight containment processes in place, but then also teams available for doing assessment for people who have symptoms.
Yeah, that's great. If we could get the next slide. So, the CDC, which is great, they're giving us guidance. They're saying like what you can do, and I think we all anticipate that there's going to be more and more guidance coming in. This just a few days ago, so new guidelines for fully vaccinated individuals. This is questions come up a bunch with students. Will they still be required to get tested weekly?
Yeah, it is really good to see the CDC active about giving us evolving guidance. And I think it will be evolving. This first set of principles for how to manage folks with who are fully vaccinated and some guidance for how you can behave after vaccine is really helpful. And I think it'll be the first step of a series. In this first initial, how to interact with others, they're still focused primarily on social settings, so in the workplace, in the public spaces, on campus, we are going to maintain the current policies for the winter semester at this point. The really helpful guidance has to do with how to manage folks after exposures. So as we talked about, I think even 2 weeks ago, it still will be the case that if folks are fully vaccinated, they need to travel, they're going to still probably be required to be tested, according to the airline principles, but we're not going to require quarantine of those folks upon coming back if they're asymptomatic. And, after even exposures, if you're fully vaccinated and asymptomatic, it may not be the case that you'll have to quarantine. So these are going to be the elements of the guidance that I expect to evolve.
Yeah, I mean, certainly, I think it's going to be each week we're going to know more. And the news on vaccinations is really looking great. We're going to talk about it a bit with Dr. Sati. So back to gatherings and social activities. And this is something I know you and I talk about this as parents. It's like we don't want people to not interact. You got to interact carefully and in smaller groups. But what can you tell us? Are small outside gatherings of students with social distancing rules strictly adhered to are allowed at this time?
Yeah, and it is getting nice out, and we still believe that transmission is less likely when you're outdoors, so the virus disperses. So being outdoors is a good idea. You can be with your group. I think students have families of friends that they're around, and I think that our current situation on campus of low transmission and low rates of new cases suggests that students are being really thoughtful about staying within their groups. So that I think is something that we'd like to see. People staying with their groups for now. I think, again, as more and more people are vaccinated, we're going to see the ability to expand that.
Yeah, and I know too, Rob, some of the guidance on from the state on gathering sizes, all that is evolving and changing. And, again, it's this idea of this dial as things get better. But the FAQ section of the Maize and Blue website does have a link to that information. So, I think, thank you for everything you're doing. I think that's the end of our section, and we're going to move on to vaccines.
Hi, Preeti.
How are you, Sandro?
I'm fine.
Good to see you.
Yeah, nice to see you.
If I haven't seen you. So, boy, things have gotten better since we saw you last, and we were hoping this would be the case. But can you tell us what, there's a lot of noise around vaccine and concern and optimism, but what's the outlook looking like right now for our state and really for the country?
Yeah, better. We were, until last week, and we were giving first doses, and we've started to give first doses. We're not getting as many as we'd like, and I think I said it on. We have the capability to give a lot more vaccine through the university. We've been working through Michigan Medicine. We've been working very hard to try and get the one. We've been giving out 100% of the doses that we get. The state, as was mentioned, is opening up to 50 and overs, and that'll be by March 22nd, and then 50 and overs currently who have underlying conditions. At Michigan Medicine, we still have a lot of our 65 and overs to do. So we're still focusing on that group right now. Just to say, it's been a year yesterday since the pandemic occurred. And to let everybody know, we have 22% of our population in Michigan vaccinated, fully vaccinated. And so I think that is a testament to how great the efforts have been around the country. And this is a positive thing. We have a new vaccine that's come out, Johnson & Johnson. Janssen is the other name for it, and it looks great. It's just as good as the other ones, and it's a one dose. So we're trying to figure out, the states figuring out how to use the vaccine, how to distribute it. So it's getting better. The numbers are going up. They're not exactly where we want them to be in terms of how much vaccine we're getting, but we'll get there. And President Biden said yesterday that everybody will be able to get on the list to starting in May 1st, and I think the state may even get there sooner than that. So it's positive news.
Yeah, thank you. And I think that we did hear some positive news from the state. I actually haven't had a chance to dig into it because I was watching the basketball game, but that 16 and above. So it looks like even in April, we're going to start opening things up. I just want to make one comment because you brought this up, Sandro. A lot of questions I get are about, which vaccine should I pick? And I say, get whatever you can, whenever you can get it.
Yes.
I'm afraid that people are focusing on vaccine efficacy without fully understanding that isn't really a number about an individual.
Yeah.
And we have to think of vaccination not as I'm doing this to protect me. And of course it does do that, but you do this to protect everybody. And think about it really at a population level. I would have no trouble. I mean, I happen to get Pfizer because I'm a physician at the health system, and that's what we had. But I would have no concerns about my friends and family and my children getting the Johnson & Johnson or whichever vaccine is available. So I just want to emphasize that.
Yeah, absolutely. And then really what is key is hospitalization and deaths. And these prevent hospitalization and deaths at about 100%. And so it's just like Pfizer and Moderna. The Janssen is a great vaccine, and so people should get it. As you're saying, wherever you can get the vaccine, get on the list. Whether it's Michigan Medicine, whether it's Rite Aid, whether it's CVS, whether it's the county, and we're working very closely with the county too. So there's been a great effort. I have a meeting later today where we're going to talk about distribution.
Yeah, thank you. And just Johnson & Johnson and the Janssen are the same vaccine.
Yes.
It's just a little confusing for people, including myself. So thank you. Can we get clarification on what is going on with vaccines at Michigan Medicine? You touched on this. Should we wait to hear from Michigan Medicine, or should people go and try to get appointments with their drugstores or the health department, as you mentioned?
Yeah, I think people need to get it where they can right now. We're starting to get more doses, and for good reason. The state has distributed vaccine to areas that are what are called social vulnerable, that have a high social vulnerability index. And so these vaccines are going to the right places. We're starting to get more vaccine now, but we're still not getting as much as we'd like. So I think we're, again, going to be focusing on the 65 and overs as we get more vaccine. We will move as soon as we can to the other groups, but people should get the vaccine where they can. Absolutely. And so you don't need to wait to hear from Michigan Medicine to get your vaccine.
Can we get the next slide? And I did get a message too, right before the meeting, that Ford Field, there's likely going to be a big mass vaccination event there. So Stay tuned. I think, again, every day is a little different. And this is not like, it's not going along like this. It's actually going like this. And, there's a hope that even getting up to 4 million doses a day. And I think it's not unrealistic. So good news there. So do you know if Michigan Medicine will prioritize instructors as 1C?
Well, so it won't be up to us, right? It'll be up to the state. One of our principles that we follow is that we really want to follow state guidelines, and those change. And so I don't want to predict what they're going to say about 1C. We are going into 1C already a little bit with the 50 and above, starting to get into people with risk factors. So we'll have to wait. That's unclear yet whether instructors currently, the instructors are not in prioritization 1C. So I can't say if they will be, but again, if we're saying April or May when everybody can sign up on the list, that's pretty darn soon. So yeah.
And as I was talking, I got a text from Rob, who wanted me to share too, that the Ford Field event, for example, this is additional, it's incremental. And so, like you mentioned, the vulnerability issues are being looked at nationally, and there's actually a much more federal involvement with this. So question about the Johnson & Johnson vaccine, is this potentially harmful to those who are immunocompromised or have autoimmune disease because there's an adenovirus used in this vaccine? It's a good question.
Yeah, it is a really good question. The answer is no. The short answer is no. It is a virus, adenovirus 26. But what they do is it's a non-reproducing virus. So they change the virus so it can't reproduce. So whatever virus you get in your arm is all you're going to get. There won't be any ability of the virus to reproduce itself. So the answer is no. Immunocompromised patients can get this. People who have autoimmune disease can get this, and they should. Those people should get vaccinated either with Janssen, Johnson / Johnson & Johnson, or Pfizer or Moderna.
Okay, great. And I think there's one question left. Maybe not.
Okay.
Okay. There was
Thanks very much, Preeti and everyone. And I think we do have time now to open things up to a very large number of questions that have come from the viewers. Please recognize that the Amazing Blueprint website will have lots of information up today. There'll be an email going out from me this afternoon with information and more links. Some of the questions that are popped up on the Q&A are actually handled in this information we're pushing out, and some others there aren't answers for yet. But Preeti, why don't I turn it over to you to address some questions from the audience.
Okay. This is one that's come up a few times, and it's for you, Mark. How is the university advocating for greater vaccine access for staff, faculty, and students?
So, I think access to vaccine right now is the most controversial part of our nation's response to the pandemic. There's guidance that comes from the CDC, and individual states are interpreting that guidance differently. Vaccines are being supplied both through the state and directly through a small number of federal programs, and things are all over the place. And you call up friends and neighbors or talk to relatives in different states, and different things are happening. So it's perplexing, it's confusing. One of my great personal disappointments is in the first few weeks of vaccine availability, Michigan Medicine got very significant amounts of vaccine. We ramped up our delivery mechanisms. We were able to vaccinate essentially our entire health system, and then begin on other essential employees like our public safety folks and others. And then all of a sudden, the state decided that wasn't equitable and changed the rules. And I could appreciate the arguments that are being made, and they're difficult questions, and that they're elected officials and they're responsible. So vaccines have now been shifted more to county health departments. The Washtenaw County Health Department is getting much more vaccine than the University of Michigan is. It's also being distributed through pharmacies, as you said, and pharmacies have different online sign-up procedures. So the tech savvy seem to be doing better than folks that don't have access or aren't as tech savvy. It's not a great system. So the advocacy I'm doing with the state, and we do have access to the heads of the Michigan Department of Health and Human Services and the governor's chief of staff and the governor herself, is Michigan Medicine can deliver as much vaccine as we get. We can deliver 25,000 doses a week. We can ramp that up and do even more. We're responsible for hundreds of thousands of patients who look to us for their health care. And now that the age limits are basically opening up, Governor, please send us vaccine, we'll deliver it. And I'm confident it will get better. You heard the president last evening pushing up the date that he thinks folks will have access. I think he knows the rate at which vaccines are being produced and then pushed out from the manufacturers. So the overall supply will go up. In terms of advocating for our faculty and staff to be given special priority, actually, I haven't been doing that. And the reason why is there are many groups out there that are also making claims that are actually very valid claims. So, should I tell a 30-year-old with cystic fibrosis who hasn't been eligible yet that a professor teaching a course should, who's otherwise, healthy and 40 years old should go in front of them? I don't want to make those decisions, and I think it's a really tough call, and the state really is trying as best they can. You could tell, though, that our plans for the fall are predicated basically on everyone who wants to be vaccinated will have access. And although it doesn't feel that way yet, in the coming weeks, it really will, and we'll ramp up. And if you think about 25,000 vaccinations a week, we've got 46,000 students. That's, 2 weeks of work here, boom, boom. Or we've got a few 10,000, 20,000 employees, a week of work. So with supply, we can get you vaccinated, and the supply is going to get better. So that's where we are.
Great. And I agree with that. And I think things could look really different even a couple weeks from now. So everyone just hang on and be optimistic.
It's hard. Yeah.
Yeah. This question's for Provost Collins. Most large lectures will remain remote. That was what you described. How is large defined?
Yeah, I'm happy to say a bit more about that. As I did note in my remarks, the schools and colleges are the ones that will be making decisions about course modalities, and those decisions are going to focus on pedagogical and programmatic needs. Of course, again, while maintaining the policies and procedures for those who have special health needs. So we will not announce centrally a single one-size-fits-all size for remote instruction, because the nature and the size of our classes is really quite different across our programs, across the schools and colleges. So each unit will be determining the class size above which lectures would be held remotely, and we would expect some variation in what that size would be.
What I'll add to that as well is, at least at the beginning, unless we're pleasantly surprised and an overwhelming majority of students are vaccinated, we're still going to need to wear masks in the classroom, and we're still going to need some degree of distancing. We won't be able to pack 300 students into our largest lecture hall, not until everyone's vaccinated or until the vast majority of people are vaccinated. So some of the limitation in class size has to do with rooms that are available that allow folks to spread out adequately and how well we can schedule those rooms. That's why we've devolved this to local leaders who are familiar with facilities and are just going to try their best to work it out. And please, look at the fall semester as a transition. It's not going to be neat and clean. There's a lot of uncertainty, a lot of local variation in needs and capacities. It's our intention to be an in-person residential education institution. That's where we provide the best opportunities for our students and faculty. And we're all going to work together to get as close to that as we can be in the fall, and presumably all the way there in the winter.
Great. So this question for Martino, may we hear more specifics about how the sophomores will be engaged so they can meet each other and build communities that they could not as freshmen? And obviously there are students who've actually never set foot on this campus.
Right. No, thank you, Dr. Milani. And, we're in the early stages of planning, but I can share a few quick examples. One of which starts with orientation, which is a partnership. Really, it's under academic affairs, but we partner with them, and orientation, I believe, will be largely virtual this summer. However, what they're looking at is making some of the information sessions available to second-year students, to get a refresh and a reboot. Then moving into the fall and welcome week, what we're working with our partners in academic affairs on is actually having tracks of programs that would be available and open to second-year students. So that's not normal. Normally, it's a first-year student experience, but we want to open that up. And then the third example really focuses on some of the approaches and the principles that we learned from this winter in terms of how to enhance student engagement through more streamlined communications, like our weekly every Sunday email that goes to every student that tells them what's happening this week, the building cohorts and groups and facilitating that, our resource navigation program, which staff reach out to students who we think may not be connected with any formal groups, and then co-curricular integration, which I talked about earlier. So lots of work to be done. Certainly in future briefings, we'll talk more about that, but it really starts this summer and builds into the fall.
Yeah, the only thing I'll add is don't wait till the fall. or the summer. You can get engaged now also. It's not perfect. And I know it feels weird to do things on Zoom, but there was one event, like it was a crafting, that I think that's something you can really do, and, in little breakout rooms and stuff. So also look for opportunities now to help make Michigan feel like your own. It is a big place, but it's a good place. And, just the more you can do, like a little effort. And then again, in the fall, I think hopefully all those pieces will make it a little bit simpler.
And I would encourage students, to your point, Preeti, to look at this Sunday email that they'll get this weekend. There are events, programs, engagement opportunities that are not all Zoom. So just, be aware of what is happening now, and then we'll continue to build on that in the future.
Great, thank you. Question, Sandro, someone is asking about vaccines and the variants, and what's the latest?
The latest is a lot, but there is so the B.1.1.7, which is the variant that came from the UK, or we don't want to call it the UK variant, but it really caused problems there, is now in this country. And there's also been the variant, the B.1.351. Those variants, the vaccines that we have will still protect against those variants, fully against B.1.1.7, and essentially the severe disease and hospitalizations for the B.1.351, which, so we are concerned. We worry that the B.1.1.7 is more transmissible. There's some evidence that it may be even a little bit worse. So we're still, while we're happy that the numbers are going down, we still watch those carefully. And one of our, Adam Loring, and we're lucky to have him, and he's doing our sequencing here. So he's looking at the state's numbers, and we'll get a sense of how many of those variants, how much of either variant or strain, as we would call it, is here. But we have to watch for those genetically, as we keep the numbers down. If we keep the numbers down, coronavirus isn't even as it doesn't change even as much as influenza. So coronavirus is an RNA virus, and it mutates. But if we keep the numbers low, it won't mutate that much. It's the fact that there were so many cases all around the world that caused these mutations. So let's follow President Biden's lead and keep everybody safe and get everybody vaccinated. And I think that will work itself out.
That's great. Adam Loring would be proud of your explanation. So I don't know if he's listening. And the only comment I'll add is that the Johnson & Johnson vaccine, which was tested in South Africa, where one of the variants did emerge, I don't want to call it the South African variant either. Again, it's apples and oranges. Like, it's very hard to really compare that to what is happening here. And it gets at the fact that when someone who's fully vaccinated develops severe illness, we're going to need to sequence those strains and really understand this. But in the meantime, we can't have out of control spread.
Preeti, I wanted to make one point of a question that keeps coming up that's simple to answer, and the provost can answer it, about the spring and summer. So, we're talking about all these changes. We're talking about fall plans. We're talking about way more vaccination coming down the pike. We've already spoken about the spring and summer, but I think folks want to be reminded of the plans and reassured of where we are, with so much attention now being focused on the fall. Susan, could you briefly recapitulate our summer and fall, some spring and summer?
Yes, of course. So as you know, we are doing quite a bit of work to plan for the activities during the spring and summer terms. And as we have said, those classes that involve University of Michigan students, and by that I am certainly including our new students who would be joining our university community. So classes that involve University of Michigan students will be given the highest priority in terms of how they should be delivered. And that information has already been shared out to schools and colleges. We anticipate that overall, the mix of in-person, hybrid, and remote classes during the spring summer would look similar to what we're doing for the current semester. And then decisions about other on-campus activities, and that would include pipeline programs for undergraduate research, for example. Those will be announced more specifically in the coming weeks. So please stay tuned for that additional information.
Thanks. And there are a lot of questions coming through, and this has come up before, about making vaccination mandatory. President Schlissel, do you want to just speak to that? And maybe that will be probably how we end this.
As of now, there are no plans to make vaccination mandatory. We'll revisit this as time goes by. Right now, the vaccines that are approved under emergency use authorization. Once they get fully licensed by the Food and Drug Administration, employers do have the ability to make vaccine a requirement depending upon the nature of the workplace. But we really haven't gone deeply into that yet. So there's no current plan to do that. But I can't urge people strongly enough. This vaccine has been administered to tens of millions of people in our country with a side effect profile that's probably best of any vaccine that's been developed. Nothing is happening, nothing bad is happening, with an efficacy that's as good as any vaccine I've ever heard of. So ultimately, we're going to be a residential higher education and research institution again. And the best way to protect yourself is to be vaccinated. There may be things that happen in the fall. For example, we may decide that if you're vaccinated, you don't need to undergo surveillance testing for COVID. Or if you're vaccinated and you want to live with multiple vaccinated roommates in a triple, good for you, you can do that. So there'll be, interesting behavioral incentives, but also masking is related to vaccination. As we get the population of people that are vaccinated higher and higher, we could consider pulling back on the masking requirements. But that's a communal activity. It's not one person being vaccinated. It's a significant majority of people being vaccinated. Certainly, if we want to remove masking indoors. So there are lots of incentives, both personal and communal incentives, to get vaccinated. And I'm going to strongly encourage everyone to do so. And then down the road, we'll discuss whether requirements are the way to go or not.
Yep, that's and again, I just reiterate, like if you didn't get vaccinated yet, you will. You'll have your opportunity, and we'll make special allowances with Rob's team for international students, things like that. If as we learn more, and with that, I'll turn it back over to you, President Schlissel, to close us out.
Yep. So obviously, and of course, I'd like to thank all of the folks who are on the call today and other experts we've relied on and colleagues that have really stepped up to lead the campus. Earlier today, I certainly complimented our students and our staff and our faculty for bringing down the rates of COVID transmission even before the weather becomes as warm as it is now. So that is good news. Better days ahead on vaccine availability. But I'll leave you, with two thoughts. One of the things that all leaders should know and appreciate, but I've certainly learned in spades during the pandemic, is we need a sense of humility here. We're doing our very best, and we're operating without full information, and we're trying to be driven by the institution's values. But the virus has humbled us before, and losing 500,000 people in this country is almost a mind-numbing number. It's too big a number almost to appreciate. And you see the media compares it to how many folks passed away in the World Trade Center disaster attack, or how many people died in a world war. So this is pretty profound. And just the fact that 1 year in, we're talking about how to come out from undercover with a vaccine that protects you from dying at 100% effectiveness, you got to pinch yourself to believe this. So we need some humility. We're going to make mistakes moving forward. We're going to correct them. We're going to try to communicate. We're going to take your advice. Different people will disagree on the best way forward, yet we need to pick a way forward. So this humility is going to be a watchword for me. And the second, for the broader community, which is also very difficult, is patience. There are lots of questions. Many people want definite answers. And sometimes definite answers are either not available or they're not the right answer because circumstances differ. So I ask our community for patience. As we know more, as more research gets done and we understand the vaccine better, we'll translate that into changes in how we help lead the campus. As we learn more about how you're experiencing the campus during the pandemic, we'll modify our plans to optimize as best we can for everyone's health and best interests, all different kinds of health, mental health included. So thank you all very much. Enjoy the weather as it gets warmer. Please stay safe and healthy. Be on the lookout for your opportunity to be vaccinated. Doesn't matter where, if it's Rite Aid or if it's Michigan Medicine, or if you're going to drive to Toledo, Ohio, get vaccinated. and better days ahead soon. So thank you all very much. Have a great weekend. And to our basketball teams, go Blue.